It is time that I introduce myself to those of you who don't know me. I guess I should have done this long back, but it was kind of weird to talk about myself on video. Then I got a lot of feedback over the last few days to say that I should share my background. So here goes. I'm Harshada Rajadhyaksha from Prakriti Sports Science and Physiotherapy Clinic. I started Prakriti in 1997, but I have been a physiotherapist for more than 32 years. I graduated from KEM Hospital and GS Medical College in Mumbai, and then I went on to do post-graduation at the All India Institute of Physical Medicine and Rehabilitation. When I was studying at KEM Hospital and somewhere in the second year, I realized that the education that I was getting was really valuable and had an application which was far beyond the current application of physiotherapy at that time. And I'm talking about 1985-ish. So what I mean is that sports medicine as a field was not existent in India at that time. And certainly there were no college courses that offered education in sports medicine. I was learning anatomy, physiology, pharmacology, medicine and surgery, and then the physiotherapy subjects like pain management and exercise physiology. I was not 100% sure what I'm setting out to do, but I knew for sure that I wanted to learn everything there is to learn about exercise in all its forms, and then combine that knowledge with my basic physiotherapy knowledge to make programs that would help my patients in the long run. I got the idea and I started right away. The first thing I joined was a 1-year teacher's training course in yoga. After my graduation, I went on to post-graduation in rehabilitation. But along with my education, and then for the next 10 years, I continued to do other courses, small courses, long courses, sports taping, core stability, Pilates mat workout, diet therapy, aerobics, advanced weight training, foot pressure mapping, and several more. I learned from people all over the world. I learned from athletes and sportsmen and their trainers. I learned from my teachers. I learned from my students. And I learned from several doctors and surgeons. And I learned from each and every one of my patients, and I still continue to do so. Because I believe that each person is individual and there are no two people alike. So when you think that you've finished learning everything there is to learn, some new patient will teach you even more. While I learned, I also realized what was missing in the healthcare industry that I now had the ability to provide. I am your bridge between injury and illness and health and fitness. Because I'm a physiotherapist and a rehabilitation expert, I understand pain and injury and its medical management. Because I have extensive knowledge of exercise and diet, I can guide you step by step from injury and illness to any fitness activity or sport that you wish to do. Over the last 30 years, I have been lucky to have worked with literally the best orthopedic surgeons in the fields of sports injuries, arthroscopic surgeries, joint replacement surgeries, spine surgeries, and trauma. I have been a part of some amazing sportsmen's careers. I have taught and mentored hundreds of new physiotherapists and seen them flourish. I have also consulted and treated thousands of patients and been a part of their rehabilitation and recovery. I think I have a unique method of treatment that combines clinical reasoning and evidence-based practice, but also incorporates the patient's unique circumstances and their individual goals. I like to think that when I'm consulting, I put myself firmly in my patient's corner. While I continue my clinical practice, I also want to impart this knowledge to young students, therapists, trainers, and anyone else who needs it. So this series of videos will be small snippets of tips and advice, information, clinical reasoning, and exercise demonstrations that you can use. I will be talking about what I know best, that is injuries and pain, health and fitness, and nutrition and food. But please remember that this is only general advice and it might not specifically apply to you. It is always best to consult a physical therapist personally so that they can make programs that are safe and effective for you. And oh yes, if you are not already following us on all our social media platforms, please do so that you can stay updated with all the videos that I plan to post here. If you need a consultation, find that information here too. Thank you and bye for now.